Welcome. My name is Trishanda, and this is Leukocyte United, a nonprofit reproductive health care network, where our primary focus is PCOS, endometriosis, fibroids, thyroids, fertility, and child. Today we're going to be covering the basics on breastfeeding. However, before we begin, I have a very urgent disclaimer. I am not a licensed medical professional. The information provided today is just for educational purposes and should not be used to diagnose or reference as treatment guidelines. If you have any concerns regarding your reproductive health, please contact your physician. If you do not have a physician, feel free to contact leukocytellc@gmail.com and I'll be happy to connect you with a licensed, reputable medical professional. Breastfeeding has been around since the dawn of time, and in many ancient societies, mothers were advised to breastfeed their children up to 6 months and then proceed with cow's or goat's milk. However, concerns began to rise when mothers were not lactating or babies were not latching. This led to a high infant mortality rate, as well as the creation of wet nurses. A wet nurse is a woman who cares and breastfeeds another woman's child. Despite their compassionate sacrifices, wet nurses were looked down upon as lower class citizens, criticized by their employers for their appearance, appetite, and not being allowed to nurse their own children, forcing the wet nurses to find alternative care, which included instant formula and at that time resulted in infant mortality. Towards the end of the 18th century and the beginning of the 19th century was the industrial era. This drew many concerns. Since women were now working, they were subject to time restraints. Some scientists believe the surge in educated women will interfere with the enzymes in breast milk. In 1854, the breast pump was created. Contrary to popular belief, the breast pump was created for infants who had a hard time nursing. However, it was ideal for busy mothers. During the industrial era, men also complained that breastfeeding ruined their wives' clothes, made them less affectionate, as well as less fertile. Up until 1920, wet nursing was socially acceptable in the United States. Hospitals even had wings for wet nurses. However, today, wet nursing is not as popular. It is now called cross nursing, and mothers primarily hold private groups. Breast milk contains stem cells, which lowers the risk of infections, lowering the risk of asthma, allergy, as well as eczema. Studies also state if you breastfeed your baby for the first 6 months, it lowers the chance of ear infections, respiratory issues, as well as diarrhea. Breast milk lead to a healthier sleep pattern, reducing the risk of SIDS. The fatty acids found in breast milk assist with brain development. Studies state that children that are breastfed usually have higher IQs. Another study of 10,000 children state that babies that are breastfed are 30% less likely to have behavior issues by the age of 5. Breastfeeding also creates a bond between mother and baby, allowing the mother to know when her child is full, reducing the risk of overfeeding. Breastfeeding also lowers the risk of breast and ovarian cancer. Breastfeeding also naturally helps you lose weight. Milk production burns 300 to 500 calories per day. If you burn 500 calories per day, you will be losing 1 pound a week without working out. When you breastfeed, you have delayed ovulation because you are producing prolactin. When prolactin is released, estrogen and progesterone stay at bay. However, once your prolactin levels drop, estrogen and progesterone levels rise. In some cases, it can take 6 to 8 months for your menstruation to return. Now let's double back to the end of the 18th century and the beginning of the 19th century when men were complaining that women were less fertile due to breastfeeding. Essentially, they were right. One of the most amazing parts of breastfeeding is that if your baby gets sick, your body naturally recognizes this and begins to produce more antibodies to fight off the infection. This is not something that you can find in formula. And one of the most obvious overlooked perks about proceeding with breastfeeding is that it's cost efficient, especially in today's society. Every dollar counts. And before we sign off, we would like to leave you mothers with this quote. Breastfeeding is a connection that cannot be instantly formulated. I'd like to thank you for your time and tuning into the basics and the benefits of proceeding with breastfeeding. Please be sure to stay connected on all of our social media platforms. On Instagram, we are Leukocyte. On YouTube, Leukocyte United. If you're looking for reproductive assistance or would like to be a referred physician, please email leukocytellc@gmail.com. More life.